Erwin, what are the tasks with regard to collecting and analyzing information in the context of biosamples?
Well, there are lots of tasks, many tasks, and there are many challenges as well. So biosamples are a key ingredient in precision medicine approaches, whether it's research, but also whether it's then clinical practice. Biosamples and the quality of biosamples are key and essential because if we get biosamples that don't have a clear record of what happened to them as they were taken from a living body before they were going into the freezer, and then what happened in the freezer, we can't really assess reliably the data that is generated from the biosamples, mostly genetic data, but also other omics data. So I come to this initiative from the perspective of having data generated from biosamples out of biobanking initiatives and bringing those data together with the data from the life of the patient. And this is data that relates to the medical records, the data that relates to the treatment, what kind of treatment the patient had received, and so on. The conventional medical data, but also increasingly data out of daily life through sensors and monitoring and so on. So what are the hurdles? The hurdles are clearly what are we allowed to do with the data? That is one thing where we need, obviously, for every question, bringing these kind of data together, patients' consent. And there we have some challenges that we need to overcome in changing the regulations for what we can do with the data. That's an issue for politics, policy, and legislation. And the second aspect is harmonizing data. We cannot have things that cannot be compared together or analyzed together, brought together. We need to find ways to have many heterogeneous types of data, such as data that come from biobanking initiative, from biosamples, then molecular data from those samples. And we have data out of daily life, medication data, many different types of data. We call it heterogeneous data sets that have never before been analyzed together. And we need new methods. We need to find new methods to accomplish this task. How can these different types of data be analyzed and studied together to make sense, to generate insights?
The Hasso Plattner Institute is working on all this.
Hasso Plattner Institute is working in particular on the data side. We are generating a platform, we call it Health Cloud or Gesundheitscloud, where we can bring together these different types of data, including data that come from biobanking samples, but also data from life, etc. Bring those data together and hold them in a format that they can be analyzed by new machine learning approaches, that's the buzzword, deep learning, machine learning approaches that are not statistical in nature, that are completely different and new, and that can deal with heterogeneous types of data. We have faculty, professors that have great expertise in these new algorithms to analyze large, complex, heterogeneous data sets.